let's go back to the reason you got breast implants, okay? What was the motivation behind your decision? And I want to know, once you decided to augment your breasts, did you receive full disclosure and transparency from your surgeon about the potential complications and long-term costs involved to maintain them?
When I went to go get them, I wanted to fit this perfect look that I thought was perfect. I was trying to get into the modeling industry and I wanted to have fuller breasts and I wanted to be accepted and I wanted to be loved. And the doctor that I went to at the time, he did not explain anything except for that I could keep them in forever. There was no health issues and that, yeah, that it was gonna be great. There's no downside to it. I went and I did the surgery, and, I was not aware of all the complications that would come down the road.
Now, Joy, after experiencing many symptoms associated with BII, you had your implants removed and are now what they call an explant, as am I. How long did you have your implants for, and what type did you have? And when did symptoms first arise after the breast augmentation?
So I had my implants for 12 years, and I got silicone implants, and I had so many horrible symptoms, and I've had them out for now 6 months, and Doctor Rankin, he has definitely changed my life because all of these symptoms have slowly gone away, and I've never felt healthier. I had depression, I had pain, and I thought it was normal. I'm just like, "Oh, I can't lay on my side, that's normal, I have implants," you know? And the symptoms, they got worse over time, but in the past couple years, I really started to focus on my health. I was doing everything right, and I was just getting worse. I was getting more sick, and I would get migraines all the time. And then I had trouble sleeping. The inflammation in my body was getting worse and worse, where I was having crazy cravings and I was struggling with depression where I wouldn't want to wake up in the morning. And all of those have really went away, and not instantly, but some of the stuff instantly did go away. And then the biggest thing, which I'm really excited about, is my thyroid. I just got blood work back, and my thyroid is normal levels finally for the first time in since I was a child. So
This is fantastic news. Now, Dr. Rankin, some doctors and surgeons and other medical professionals don't believe that breast implant illness is real, with many chalking it up to a kind of hysteria fueled by social media. So, and I'm going to go one step further. A research review published in Aesthetic Plastic Surgery in 2022 titled Breast Implant Illness Real Syndrome or a Social Media Phenomenon. Then they go on to say that BII is a condition characterized by elusive diagnostic criteria and self reported diverse, disabling, and distressing physical and psychological symptoms. Then the authors wrote that the condition is perhaps becoming the most controversial subject in aesthetic and reconstructive breast surgery, generating heated debates between those who do not believe such a condition exists and those who demand its acceptance as a recognized diagnosis. I'd love to hear your thoughts. What do you say to this?
All I can say is, in my practice, doing 500 explants plus a year and seeing the majority of my patients improve and say they feel better and say they feel healthier, the proof is in the pudding. You look on social media, you have all these groups of women getting together, discussing their symptoms, discussing their process, and just speaking the truth. There's no need for these women to make things up. They've been struggling for answers for a long time. Their health has declined for a long time, and they're getting better. And you can't really stop the power of social media and women collectively getting together and going over this topic.
Exactly. Joy, how long after explanting did your symptoms take to reverse?
as soon as I woke up from the surgery, I mentally was so clear and so excited, and I didn't regret my decision for 1 second. I was like, why didn't I do this sooner? And then my health just started to get better and better as I was recovering. And I checked my blood work periodically every month since. and it's gotten better to the point where I've gotten off medication completely. So I'm really excited about that. And that's 6 months later.
Wow, what a difference. Dr. Rankin, this must warm your heart.
Hearing stories like Joy, that's why I do what I do, and I hear it every day in my practice, and that's very rewarding.
It sure is. Now we're going to talk about capsulectomy. When we talk about the removal of the implants and the capsule, which is the scar tissue that grows around the implant, is what many surgeons and countless women believe must be done to make a full recovery. What are your thoughts on this and why?
There's a lot of different thoughts of opinion on this in the plastic surgical community. In my practice, seeing the possibilities of developing problems within your capsule, like the ALCL and the squamous cell that you talked about, those are reasons in and of themselves to remove the capsule. There's been some doctors that have had studies saying that some of the silicone particles can leach into the capsules. There's been other studies that have refuted this also. So we're still trying to make sense of why we need a total capsulectomy. I think if you look at the surgery itself and the possible problems we can have with the capsule, it's just prudent to remove it when you're doing the surgery.
Especially when there's more than 365,000 women that have received breast implants in 2021. That's a statistic. I'm sure that number has gone up, but that alone in 2021 was a 44% increase from the year before. So breast augmentation still remains one of the most common and popular plastic surgery procedures performed in the US. So it's really, really important to spread awareness about what Joy went through, what I went through, and what all of your patients have gone through, silently suffering without anybody giving them the credence that they deserve.